Now that we understand the basic anatomy of the respiratory system, let's look into how the lungs actually bring air in and out, a process called ventilation. Although breathing seems effortless most of the time, it's a very orchestrated process involving a balance of pressures, muscle movement, and airflow. Now, to set the scene and provide a bit more context to what we described earlier, I want to go back to the pleura. The pleura are two very thin layers which envelop the lungs, secreting lubricant in the form of a serous fluid and allowing the lungs to expand and contract freely. If we zoom in to have a look at this, we can start to label some of these structures. The outermost layer is called the parietal pleura, and the layer that clings to the lung and covers it is called the visceral pleura. The space in between is filled with fluid, and in normal states it isn't really a space but a potential space, which in reality is tiny, about 15 micrometers. The pleural fluid allows these layers to be sandwiched together without causing friction and damage. The whole process of ventilation, of inspiration, breathing in, and expiration, breathing out, is dependent on generating a pressure differential. This can come across as a little complex, and the explanation I'm going to use in this video is heavily simplified, but let me know if you'd like a more detailed explanation. So we talked in a previous video about dissolved particles in a fluid moving from areas of high concentration to low, trying to achieve that equilibrium, where the concentration is equal in both places. Well, the same is true of gases. Gases will try to move from an area of high pressure to an area of low to achieve equilibrium. The body doesn't have a way to force air to move into the lungs. There's no mechanical way of doing that outside of using a ventilator. So, in order to get air to move from the outside environment in, the pressure inside the lungs must decrease with respect to the pressure outside. So, this is what I mean when I'm talking about generating a pressure differential. Let's look at an example. If the outside air pressure is around 760 millimeters of mercury, and don't worry about the units, that's just standard air pressure at sea level. When you are at rest between breaths, the pressure inside your lungs is the same, 760 millimeters of mercury. The differential then between these two numbers, between 760 outside and 760 inside, is zero. There's no difference between the two numbers. And that means that air will not move in this state of equilibrium. In order to get air to flow between the outside and the inside, we must decrease the pressure inside. And to do that, we need to increase the volume of the thoracic cavity. Now, Boyle's law governs this, which is one of the empirical gas laws. If you've ever studied chemistry, you'll have some flashbacks to Boyle's law. It describes the relationship between pressure and volume inside a fixed space. Now, Boyle's law states that for any increase in volume, there must be an equivalent decrease in pressure, and vice versa. So, if there's a decrease in volume, then there's an increase in pressure. A good way to think about this is just with a balloon. Inside a balloon, you have a fixed amount of gas. If you press on the outside of the balloon, that decreases the volume inside the balloon and then will increase the pressure. And of course, eventually the balloon will pop. But there's no way to pull on the outside of a balloon and increase the volume, dropping the pressure. But what we can do with the chest cavity, we can't decrease that pressure directly, but what we can do is engage the muscles of respiration to increase the size of the chest cavity and therefore the volume of that cavity. This will lower the pressure inside, and when this happens, inspiration occurs as gas moves from the outside to the inside, down the pressure gradient. Now we come back to the role of the pleural cavity. It is vitally important here. As it is truly a fixed volume, while some serous fluid drains out into the thoracic duct, otherwise the cavity is held under a fairly constant pressure. When the chest wall expands during inspiration, this pressure differential within the pleural cavity is even greater, causing the lungs to be dragged outwards within the cavity. This overall generates enough of a pressure differential within the alveoli themselves to cause the air to move inward. Okay, so cliff notes. We know that we need to have a decreased pressure within the thoracic cavity in order for air to move inside to out, and the way to do that is to increase the volume of the chest. Now, it's the diaphragm that is responsible for most of this, as when your diaphragm contracts, it domes downward, significantly increasing the volume in that area. This process is known as quiet inspiration. In some cases, the accessory muscles, which are the intercostal muscles and the sternocleidomastoid, which is one of the muscles in the neck, can be engaged to help expand the chest even more. This can happen in exertion or when experiencing difficulty in breathing. This causes an even greater increase in thoracic cavity volume and therefore a significantly increased pressure differential, which will then cause air to move faster. Expiration, then, is normally a passive process, as once the lungs are full of air, this pressure differential evens out. The body relies on the natural elasticity of the chest wall and the pleura, which, because of the way that they're tethered together, cause the lungs and the chest to naturally recoil. As per Boyle's law, if the volume decreases, then the pressure increases within the thoracic cavity, and gas wants to move outwards, down the pressure gradient. In forceful expiration, the abdominal muscles contract, which push upward on the diaphragm, causing a further decrease in volume in the thoracic compartment. This adds again to the pressure differential and increases the speed that air flows out. The process is managed mainly passively, but the lungs do need a way to sense when to stop inspiring or stop contraction of the diaphragm. This is done with specialized cells called stretch receptors, which are found in the parietal pleura. These send messages back to the brainstem where the process is actively managed. Your lungs have a maximum volume, which is around 6 litres, and it is important that this is not exceeded. So your tidal volume, which is the amount of air that's taken in with a breath, is tightly regulated. The pattern, depth, and speed of your breathing is governed by the respiratory center in your brain, in the medulla oblongata and the pons. They both control the rate and depth of respiration through control of the muscles of respiration. They act on several inputs, just like a computer processor, to make decisions on how often you breathe and how quickly, based on the amount of oxygen and carbon dioxide in your blood. Now, this particular topic, control of respiration, can get really complex very, very quickly, but just be aware that your pattern of ventilation is dependent on many factors: oxygen and mainly carbon dioxide concentration, pH, and temperature, as well as some hormonal influences. Drugs can greatly affect this, as opioids and anesthetics work directly on these cells, depressing ventilation, and stimulants like amphetamine can cause hyperventilation. So in summary, the actual mechanics of ventilation are dependent on the generation of this pressure differential to cause the airflow. Later in the course, we'll learn about conditions where this can become difficult or even impossible to manage. Now next, we're going to look at the gas exchange element of this process, how gases move across the respiratory membrane and into our blood. Thanks for sticking with me. See you in the next one. As always, there's a quiz that comes with this video, so use it to check your knowledge and see how you're progressing.